Dr. Edwin Williams here, answering your questions in a fireside chat format on hyperhidrosis. What is hyperhidrosis? Well, hyperhidrosis is the fancy medical name for a condition that people have that causes excessive sweating of the face, underarms, and sometimes the palms, which are embarrassing to people. Imagine an executive who goes into a meeting with a very nice suit and starts to pit out their suit. Or a young woman who's going to a fancy restaurant and she's sweating in her blouse. So Botox, believe it or not, is used to treat hyperhidrosis, and it's FDA approved for that. Many patients, only about 40% or so, only need one treatment. And some might need an additional treatment at 9 to 18 months. Subsequent treatments may be needed 2 years later, but about 40% of people really only need one treatment. So at the time, a starch test is performed, and what does that mean? For example, think of the underarm. Someone holds up their underarm, they're laying down, and we apply starch. And that starch area turns black, so you can see exactly what needs to be treated, where the excessive sweat glands are. And then we put a topical anesthesia on there, let that sit for a period of time, about 10 or 15 minutes, and then we go ahead and inject it with the Botox, which is virtually painless. I mean, you essentially won't feel it. A repeated starch test is typically performed at the follow-up appointment to make sure that we've achieved the outcome that we want to achieve. So for much more information on other non-surgical procedures, check out my YouTube Cosmetic Surgery channel at YouTube.com/Williams Center. Has a lot more information and videos on there. Also follow me on Snapchat at Dr. Ed Williams, all small case letters, for kind of some inside, behind the scenes things that we have here at the Williams Center.